going to see the hepatitis C virus management and treatment. So, the hepatitis C virus is a RNA virus and a part of the Flaviviridae family, so it is a negative sense RNA. This hepatitis C virus can be transmitted by sexual contact, intravenous drug use. The most common cause would be intravenous drug use. Now, the HCV antibodies. We have the antibody or anti-HCV. If this is positive, then it means active infection. If it is negative, it means clear infection. Now, this antibody is not a protective antibody as those for hepatitis A or hepatitis B, in which we have the anti-surface antibody, in which we know that the patient is vaccinated or has been immunized due to infection. Here it don't. If we have the antibody, it means active infection. If it is negative, it is clear. Now, if we have positive antibody, then we would do the PCR for RNA because we want to see how many copies. This cannot distinguish if it is chronic or active infection, acute or chronic. But also, if it is negative, and we suspect that the patient has hepatitis C virus, we will also do the PCR because at the beginning, in the few weeks, the antibody is negative, but the patient already has the infection. So now there are different genotypes. Genotype 1, 2, 3, and 4. So the genotype will predict the reaction or the response to the treatment, and the PCR will measure the response to the treatment, how many copies of RNA. Now, the treatment will include the NS5A inhibitors, NS5B inhibitors, NS3 4A inhibitors, ribavirin, and interferon gamma. So these inhibit the replication of the virus. NS5A is a phosphoprotein that is involved in the viral replication. The medications here include ledipasvir, velpatasvir, and vitasvir. And the adverse effect would be cephalea and diarrhea. NS5B is a RNA-dependent RNA polymerase, and here the inhibition of this RNA polymerase inhibits the replication, the synthesis of RNA, and so this acts as a chain termination. The medications include sofosbuvir and dazabuvir. The adverse effects is cephalea and diarrhea. NS3 and 4A is a protease, viral protease. When we inhibit this, we will inhibit that this virus would be mature and so cannot replicate on the next cell. The adverse effect would depend on the medication. We have glecaprevir, cimeprevir, doceprevir, grasoprevir. Grasoprevir produces cephalea and fatigue, but cimeprevir produces rash and photosensitivity. Ribavirin produces as an adverse effect hemolytic anemia and the teratogenicity. Ribavirin inhibits the inosine monophosphate, a dehydrogenase enzyme that is involved in the synthesis of guanine. And the interferon, this has a lot of annoying adverse effects like depression, but the depression could be life-threatening. So for that we give the selective serotonin reuptake inhibitors. Most of the genotypes, the genotype 2 and 3 respond very well to ribavirin plus interferon. The genotype 1, we give cimeprevir and ledipasvir, or any combination between, most of the times, between the NS5A and NS3 4A. So these are the direct inhibitors of the replication. Most of the time we give 2 of these or 1 and ribavirin. Now, usually for 2, 3, and 4 we give dual therapy, and for type 1 sometimes we could add another of these ones. Now, in a biopsy, how we would see these changes on the liver, it would be lymphoid aggregates with macrosteatosis. So this is hepatitis C virus. Now in the next video we will compare this with the other hepatitis viruses.